we want to help expecting parents start a healthy family of their own. The UC Davis Children's Hospital provides plenty of resources, including genetic screenings for expecting mothers. Here to explain more is maternal fetal medicine physician at UC Davis Health. We have Dr. Amelia McLennan. Great to have you here on the show.
Thank you.
Okay, so help bring a little more light to genetic screening or genetic testing. What does that mean for a mother during pregnancy?
Well, mothers have a bunch of options for genetic screening and testing during pregnancy. Screening tests involve a risk assessment for determining whether you're high or low risk for certain genetic complications during pregnancy.
Okay.
And then mothers have the option of having diagnostic testing, which is taking an actual sample from pregnancy to do direct genetic testing on it.
Okay, and what type of tests are there?
So there's a basic California state screening program, which is offered to all expectant mothers in California, which gives you a risk assessment for some of the most common chromosome problems. That's things like Down syndrome and other genetic abnormalities.
Okay.
And then a newer test is something called non-invasive prenatal screening. Sometimes people think of that as the gender test that you can get at after about 10 weeks of pregnancy, but it's really looking at more than just gender. It's also giving people a pretty accurate risk assessment for common chromosome or genetic abnormalities in pregnancy.
Okay, and in what type of situation would a mother be recommended, or would these testing and screenings be offered to a mother?
So the additional screening, so basic genetic screening is offered to all pregnant women, at least has been true in my experience. But the additional screening, testing, and testing options are generally offered to women or families who are at higher risk for genetic abnormalities. Although new data is showing that that non-invasive testing is very accurate even in lower risk women.
Oh, wow. Okay, and what type of information will we get from these type of tests and screening?
So screening tests really can tell you whether you are at high risk or at low risk for some of the most common genetic abnormalities. So people who have this test usually get a result that tells them either you are high risk, meaning it's recommended to go on and have definitive diagnostic testing, or low risk, meaning you should be reassured that it's very unlikely that your pregnancy is affected with genetic complications.
And how can a mom and a dad, how can these parents take this information and find this beneficial? What type of opportunity does this offer the parents?
So I have a lot of families that tell me they want kind of as much information as possible about the health of their pregnancy, and they really want it as early as possible. So some of these earlier tests, which include both the screening test that can be done as early as 10 weeks or less than 3 months of pregnancy, or the earliest possible diagnostic testing, which is a procedure that is performed in the office, and I offer to my patients for definitive testing as early as the first trimester of pregnancy, can really help families have reassurance that the pregnancy is healthy, or to give them really important information about really serious genetic abnormalities that either run in their family or that they're carriers for, or that are new in the current pregnancy.
Yeah, and like you'd mentioned, if there's a history in someone's family line, it might be beneficial to consider these options, especially when you're trying to plan financially and have the proper health care in place for that child as you grow your family.
Yes.
Excellent. Where can people go for more information?
So you can see the website for UC Davis Health, for the Children's Hospital, or for the Department of OBGYN. We have more information about genetic testing options and how to retest.
Excellent. Thank you so much. Greatly appreciate it.
Thank you.
And everyone, stick around. A lot more to come right here on Sac&Co right after the break.
This interview involves commercial content. The products and services featured appear as paid advertising.